U.S. Drug Enforcement Agency describes fentanyl as a synthetic opioid that is 80 to 100 times stronger than morphine. Pharmaceutical fentanyl was developed for pain management treatment of cancer patients, but due to its powerful opioid properties, it is increasingly being used illegally or as an additive with other illicit drugs such as heroin, cocaine, meth, and MDMA to increase the potency of those drugs. The result of fentanyl abuse and illegal use has resulted in a dramatic increase in overdoses. In fact, the National Institute on Drug Abuse reports that synthetic opioids, including fentanyl, are now the most common drugs involved in deaths due to drug overdoses in the United States. Clandestinely produced fentanyl is encountered either as a powder, liquid, or in counterfeit tablets. As this dangerous drug becomes increasingly common and is mixed with other drugs, the National Institute for Occupational Safety and Health has published information to help prevent occupational exposure to emergency responders. The agency specifically mentions the following 4 job categories of workers at risk. They include those involved with pre-hospital patient care, law enforcement, investigation and evidence handling, and special operations and decontamination. Regarding exposure, NIOSH reports the following. Potential exposure routes of greatest concern include inhalation, mucous membrane contact, ingestion, and percutaneous exposure. Any of these exposure routes can potentially result in a variety of symptoms that can include the rapid onset of life-threatening respiratory depression. Skin contact is also a potential exposure route, but is not likely to lead to overdose unless large volumes of highly concentrated powder are encountered over an extended period of time. Brief skin contact with fentanyl or its analogs is not expected to lead to toxic effects if any visible contamination is promptly removed. As of April 2019, NIOSH has no occupational exposure data on fentanyl or its analogs for emergency responders. The agency does provide standard safe operating procedures and reports that field testing of fentanyl or its analogs is not recommended due to an increased risk of exposure to responders performing the tests. There are laboratories and environmental testing specialists that are trained to safely sample and test for this hazardous substance. These are just a few things to know about fentanyl and potential occupational exposure risks. To learn more about this or other occupational, industrial hygiene, indoor air quality, environmental health, or safety issues, please visit the website shown on the screen.
IAQ TV, the place to be.